Sarah's father collapsed at home on a Tuesday afternoon. The ambulance came, rushed him to the hospital. The doctor said he needed to stay for observation, ran some tests, kept him for 3 days. He got better, came home on Friday. 2 months later, Sarah opens a letter from Medicare. Her father owes $42,000. $42,000. She's reading it over and over, trying to understand. Her father has Medicare. He's been paying into it for 40 years. How is this possible? She calls the hospital billing department. They tell her the problem. Her father was never actually admitted to the hospital. He was under observation status. Observation, not admitted. And because of that one word, Medicare didn't cover his stay. Everything is out of pocket. The room, the tests, the medication, the nursing care. $42,000 because nobody told them he was under observation instead of admitted. This happens every single day in hospitals across America. Right now, thousands of families are getting bills they never expected because they didn't know to ask one simple question. Are you admitting me, or am I under observation? Those 6 words can be the difference between Medicare covering your hospital stay and you paying tens of thousands of dollars out of your own pocket. And here's the terrifying part. The hospital doesn't have to tell you. The doctors don't have to explain it. You're in a hospital bed, you're getting treatment, you think you're admitted. But legally you might be under observation, and you won't find out until the bill comes. I'm making this video today because everyone needs to know this before they or someone they love ends up in a hospital. So if you have parents on Medicare, if you're on Medicare yourself, if you know anyone over 65, please watch this entire video and share it. What I'm about to explain could save you $50,000 or more. Let me explain what observation status actually means, because this is where the confusion starts. When you go to the emergency room or you're brought in by ambulance, the hospital has to decide what to do with you. They have 3 options. Send you home, admit you as an inpatient, or keep you under observation as an outpatient. Yes, outpatient. Even though you're in a hospital bed, wearing a hospital gown, getting hospital care, you are legally an outpatient if you're under observation, and the financial consequences of that are devastating. When you're admitted as an inpatient, Medicare Part A covers your hospital stay. Part A is your hospital insurance. It covers your room, your meals, your tests, your medications while you're there. You pay a deductible, which for 2026 is $1,632, and then Medicare covers the rest for the first 60 days. But when you're under observation, you're an outpatient. That means Medicare Part B covers your care, not Part A. Part B is your medical insurance for doctor visits and outpatient services. It only covers 80% after you meet your deductible. You're responsible for the other 20%. And hospital observation can cost $20,000, $30,000, $50,000. 20% of $50,000 is $10,000 out of your pocket. But it gets worse. Let's say you're in the hospital under observation for 3 days. You get better, but you're still weak. Your doctor says you need to go to a skilled nursing facility for rehabilitation. Medicare will not cover it at all, because to qualify for Medicare coverage of skilled nursing care, you have to have a 3-day inpatient hospital stay. Observation days don't count. Even if you were in the hospital for 5 days under observation, those days don't count toward the 3-day requirement. So now you're paying out of pocket for skilled nursing care, which can cost $800 to $1,000 per day. If you need 2 weeks of rehab, that's another $10,000 to $14,000 on top of the hospital bill you already owe. This is why observation status destroys families financially. You think you're covered. You think Medicare is paying. You find out months later that you owe $30,000, $40,000, $50,000 because nobody told you that you were under observation instead of admitted. And the hospitals know this. They know families don't understand the difference. They know people assume if you're in a hospital bed, you're admitted, but they're not required to explain it clearly. There's a federal law called the Moon Notice, Medicare Outpatient Observation Notice, that requires hospitals to give you written notification if you've been under observation for more than 24 hours. But it's usually just a form someone hands you while you're sick and confused. Most people don't read it. Most people don't understand what it means. And by the time they figure it out, it's too late. So what do? How do you protect yourself? The first and most important thing is to ask the question the moment you're in the hospital. Whether you came through the emergency room or you were brought by ambulance, as soon as you're stable enough to talk, you or your family member needs to ask the doctor or nurse, am I being admitted as an inpatient or am I under observation? Do not assume. Do not wait for them to tell you. Ask directly. And if they say you're under observation, ask why. Ask what the plan is. Ask how long you'll be under observation. Ask if there's a possibility you'll be admitted. If the doctor says you're under observation and you believe you should be admitted, advocate for yourself. Tell the doctor you're concerned about the cost. Tell them you know observation status means you'll be paying out of pocket. Ask them to reconsider admitting you. Sometimes doctors put patients under observation because they're not sure yet if admission is necessary. They're waiting to see how you respond to treatment. But if you're clearly sick enough to be in a hospital bed for multiple days, you should be admitted. Push back. Be polite but firm. Say, I've been here for 2 days. I'm still receiving treatment. I'd like to be admitted as an inpatient. Can you explain why that's not happening? If the hospital refuses to admit you and you believe it's wrong, you have the right to appeal. While you're still in the hospital, you can request an immediate review through a Quality Improvement Organization, or QIO. Every state has one. These are independent groups that review Medicare cases. You can call the QIO and say you're under observation status, you believe you should be admitted, and you want a review. The hospital has to give you the phone number if you ask. The QIO will review your medical records and make a determination. If they agree with you, the hospital has to change your status to inpatient retroactively. That means Medicare Part A will cover your stay instead of Part B. But here's the problem. Most people don't know they can do this while they're in the hospital. They find out about observation status after they've been discharged, when the bill comes. At that point, you can still appeal, but it's harder. You have to go through Medicare's standard appeal process, which can take months. And even if you win, there's no guarantee Medicare will change your status retroactively. So the absolute best time to fight observation status is while you're still in the hospital, before you're discharged. Now let's talk about what happens if you're already home and you just got the bill. First, don't panic. You have options. Start by calling the hospital billing department. Explain that you were under observation and you didn't understand what that meant. Ask if they can review your case and change your status to inpatient. Sometimes hospitals will do this, especially if your care clearly met the criteria for inpatient admission. If the hospital says no, file an appeal with Medicare. You have 120 days from you receive the Medicare summary notice to file. The MSN is the statement Medicare sends showing what they paid and what you owe. On that notice, there's information about how to appeal. Follow the instructions exactly. Write a letter explaining why you believe you should have been admitted as an inpatient. Include any documentation you have, like notes from your doctor, records of the tests and treatments you received, anything that shows you were seriously ill and needed hospital-level care. You can also ask your doctor to write a letter supporting your appeal. If your doctor believes you should have been admitted, their medical opinion carries weight. Medicare will review your case and make a decision. If they deny your appeal, you can appeal again to a higher level. There are 5 levels of Medicare appeals. Most people give up after the first denial, but if you keep going, your chances of success increase. This is where it helps to have an advocate, someone who understands Medicare rules and can help you navigate the process. There are patient advocate organizations, Medicare counseling services, and elder law attorneys who specialize in this. Let me give you another scenario that happens all the time. You go to the hospital on a Monday. They keep you under observation Monday and Tuesday. On Wednesday morning, the doctor decides to admit you. You stay Wednesday, Thursday, Friday, and go home Saturday. How many inpatient days do you have? 3. Wednesday, Thursday, Friday. Monday and Tuesday don't count because you were under observation. So if you need skilled nursing care after discharge, you qualify because you had 3 inpatient days. But if the doctor had waited until Thursday to admit you and you went home Saturday, you'd only have 2 inpatient days, and you wouldn't qualify for Medicare coverage of skilled nursing. The timing of when you get admitted versus when you're discharged makes a massive financial difference. This is why you have to pay attention every single day you're in the hospital. Don't assume that because you were admitted on Wednesday, the hospital is counting Monday and Tuesday. They're not. Those observation days disappear. So if you think you might need rehab after your hospital stay, you need to make sure you have 3 full inpatient days before discharge. If you're getting close to discharge and you only have 2 inpatient days, talk to your doctor. Explain that you're concerned about needing skilled nursing care and you want to make sure you qualify for Medicare coverage. Sometimes an extra day in the hospital is worth it to protect your access to covered rehab. Here's another thing people don't realize. You can be under observation for days, then get admitted, and the hospital can still discharge you the same day they admit you. So you've been there for 4 days total, but you only have 1 inpatient day. 1. And Medicare might not even count that if they determine you didn't actually need inpatient care. This happens with something called a short stay admission. If you're admitted and discharged in less than 24 hours, Medicare scrutinizes the claim heavily. They look at whether inpatient admission was truly medically necessary or if observation would have been appropriate. If they decide observation was enough, they'll reclassify your stay retroactively and you're back to owing 20%. So how do hospitals decide who gets admitted and who stays under observation? It's supposed to be based on medical necessity. Medicare has guidelines, and hospitals are supposed to follow them. Generally, if you're expected to need hospital-level care for at least 2 midnights, you should be admitted. If your condition can be diagnosed, treated, and resolved in less than 2 midnights, you're usually kept under observation. But here's the problem. Hospitals are terrified of admitting people and then having Medicare deny the claim. If Medicare decides the admission wasn't necessary, the hospital doesn't get paid, and they can't bill you because Medicare rules don't allow it. So hospitals have gotten very conservative. When in doubt, they keep you under observation because it shifts the financial risk from the hospital to you. The 2-midnight rule is supposed to help with this. It says that if your doctor expects you to need hospital care that crosses 2 midnights, you should be admitted. So if you arrive Monday afternoon and your doctor expects you'll need care through Wednesday morning, that crosses 2 midnights, Monday to Tuesday and Tuesday to Wednesday. You should be admitted. But it's based on the doctor's expectation at the time, not what actually happens. If the doctor expects 2 midnights but you improve faster and go home Tuesday, you are still appropriately admitted. And if the doctor thinks you'll be fine by Tuesday, but you end up staying until Thursday, you might stay under observation the whole time, because that wasn't the initial expectation. It's confusing, it's complicated, and it puts families in an impossible position. You're sick or your loved one is sick. You're scared. You're focused on getting better. The last thing you're thinking about is insurance status, but that's exactly when you need to be paying attention, because once you're discharged, it's much harder to fix. So here's what I want you to do. If you're on Medicare or you have family on Medicare, have this conversation now, before anyone ends up in the hospital. Explain observation status. Explain the financial risk. Make sure everyone knows to ask the question, am I admitted or under observation? Write it down. Put it in your wallet or your phone. Make it a rule that anytime anyone in your family goes to the hospital, the first thing you ask is about status. And if you're in the hospital right now, or you have a loved one in the hospital, stop this video and go ask the question right now. Do not wait. find a nurse or doctor and ask, "Is my status inpatient or observation?" If they say observation, ask to speak to the attending physician and ask why you're not being admitted. Ask how long they expect you to be there. Ask if there's a plan to admit you. Get answers. Protect yourself, because the hospital is not going to protect you. The system is not set up to help you understand this. It's set up to shift costs onto patients, and if you don't know the rules, you're going to pay the price. This is one of the most important things you can know about Medicare and hospitals, and almost nobody talks about it. If this video helped you, please hit the like button and share it with everyone you know, especially anyone on Medicare or anyone with aging parents. Leave a comment and tell me, did you know about observation status before watching this? Have you or someone you know been hit with a huge bill because of it? Let's get this information out to as many people as possible. And subscribe for more Medicare tips and healthcare cost-saving strategies. I'll see you in the next one. Stay informed and stay protected.